Well, the measles outbreak that started at Disneyland is expanding.
There are 59 confirmed cases now in 5 states, and 42 of them are linked to people who visited the amusement park. Dr. Christopher Crnich is an expert in infectious disease from UW Hospital. Nice to see you. Thanks for being here.
Well, thank you, Susan. Mark, it's a pleasure to be here.
Are there any measles cases reported in Wisconsin so far?
No, there are not.
There aren't. Okay.
So, should you get a shot? Should you get a booster? Who's at risk here?
So people who haven't been vaccinated are at the most at risk, and the cases that have been reported in California, over 80% of the cases were in unvaccinated individuals. So if you've had your vaccine series as a child, you're generally protected. It's really that population where they got one of the vaccines of the 2 that they should have gotten during their childhood or didn't get any vaccine as a child that we are worried about acquiring measles.
So if you've been vaccinated for measles, there's no reason to not visit Disneyland, for example.
Correct.
You're safe to visit the amusement park.
Absolutely.
But for people who are born in certain years, there is a concern. And how does that break down? So
people who were born between 1957 were naturally exposed to measles. We didn't have any vaccine available then. That window between 57 and 67, we were using a inactivated version of the vaccine, which probably wasn't as effective as our modern day vaccine. Pretty much anybody born after 67 and has gotten the modern day vaccine can be considered protected.
Okay. So if you're in that window, what do you do?
So if you're in the window where you're not sure whether you got your vaccine series or got the old vaccine, then talking to your doctor about having your blood tested, where we can actually measure titers of protection to measles, is probably the best way to go.
How serious is measles?
So measles is generally a fairly benign viral infection. Early on in the disease, it behaves very much like flu or cold, associated with fevers, cough, runny nose, sometimes irritated eyes. It differs from those other infections. After about 3 days, people generally develop a fairly impressive rash that starts on the head and spreads to the body and the torso. And most people recover after 2 to 3 days after the rash has appeared. About 1% to 5% of patients will get fairly ill, usually with a pneumonia that requires hospitalization. And the cases in California suggest that about 1 in 5 have gone to the hospital. And then it's only about 1 in 1,000 patients where we run into things that really put people at risk of death.
So if you're concerned, check with your doctor, but don't lose sleep.
That's right.
All right, doctor. Thanks very much.
Good to see you.
Thank you.
Thanks for coming tonight.